Imagine treating erectile dysfunction without pills, needles, or surgery. Just sound waves. It sounds futuristic, but it's here. And it's changing the way we think about ED treatment. Let's dive into shockwave therapy and see if this new technology really delivers. Chapter 1. What is shockwave therapy? Also called low-intensity extracorporeal shockwave therapy, LESWT, uses low-energy sound waves targeted at the penile tissue to improve blood flow and erectile function. Targeted at the penile tissue, stimulate blood vessel growth and improve blood flow naturally. Chapter 2. How it works. Handheld device delivers sound waves to different areas of the penis. Usually last 15 to 20 minutes, no anesthesia required. Stimulates natural repair processes in blood vessels and nerves. Chapter 3. The benefits. Here's what makes it so appealing. It's completely non-invasive. No cuts, no injections. It avoids the side effects of ED medications. It may even lead to long-term improvement by actually repairing blood vessels. And the sessions are quick, done in under half an hour. Chapter 4. The drawbacks. But, and there is a but, shockwave therapy is still considered experimental in many places. It's not FDA approved for ED yet. Results can vary from person to person. It usually requires multiple sessions, and it can be costly, especially if insurance doesn't cover it. Chapter 5. Who can benefit most? It's most effective for men whose ED is caused by poor blood flow, what doctors call vascular ED. It's also an option for those who can't take oral medications or who don't respond well to them. However, it may not be ideal for men with severe nerve damage or ED caused by psychological factors. Chapter 6. What to expect after treatment. The best part? There's no recovery time. You can go right back to your normal activities, even the same day. Some men notice improvement after just a few sessions, while others may take a couple of months to see results. Chapter 7. The future of shockwave therapy. Researchers are working to refine the technology, and if studies continue to show good results, shockwave therapy could become one of the go-to treatments for ED in the future. Shockwave therapy might not be a magic bullet, but for the right person, it could be life-changing. So the question is, will you be part of the first wave, or wait until the science is rock solid?